Research is an enormous field with many researchers all contributing to it. It's as if we're all putting pieces in a large jigsaw, and BRACE is able to fund projects that enable some more pieces to be added to the jigsaw. And in time, we'll see the picture, and that will lead us to understanding dementia and finding a cure.
At the moment, we're looking into whether regular brushing and some forms of mouthwash can slow the progression of Alzheimer's disease and dementia, but we don't have that information at the current time. We know that gum disease is implicated in a whole manner of systemic diseases, such as cardiovascular disease and diabetes, and that's why we're undertaking this research to determine whether treating gum disease will help to slow the progression of dementia.
BRACE has helped us hugely to start projects off, to obtain data that we can use to justify larger projects. On the basis of some work funded by BRACE, we've taken an idea from the laboratory to a large clinical trial that was funded by the National Institute of Health Research. We've now recruited to that trial, and within the next year we'll know the outcome.
So if I had all the money in the world to work on Alzheimer's disease, the particular aspect I think is really important is, number one, to work out what those bacteria are, who has got the bacteria, look at different countries in the world, different places where they live, and I would need to do a very large trial and do it very carefully and make sure there was no bias at all for anything.
We do decline some research projects because they don't come up to the scientific standards that we require. But unfortunately, we have other projects which we would like to be able to fund, but for which we don't have the funds. So in the last 2 years or so, we've had to decline, I think, 5 PhD studentship proposals because we haven't had sufficient funds. They've come through our scientific review with strong recommendations, but the money has just not been available. I would like people to have a positive message. Dementia is a disease. It's not an inevitable part of aging. It's a brain disease. And as a disease, we will find the cause of the problem, and once that is found, we'll be able to identify ways of putting things right. So we must be optimistic about beating dementia.